Welcome to part 3 of our axial muscle lecture. In part 2, we were very excited. We were out at a bar, and so when Q walked in, we winked at them. We thought they winked back, so we smiled, only to realize they were smiling and waving at the person behind us, so we got really sad and frowned. And then we decided to order a plate of extra large nachos, which we're going to have to chew. There's a fancy name for that. That is mastication. And we are going to look at mainly the chewing muscles here that close your mouth and move your teeth back and forth. We'll look at the opening ones when we get to the hyoid muscles. The first muscle is the temporalis. The temporalis actually is a fan-shaped muscle that is going to go down underneath the zygomatic arch. I'm really trying hard not to draw it in. And even though it's called the temporalis, it actually attaches to the parietal bone. It comes through, and we didn't really talk about this process because I didn't want to confuse you with the condyle over there, but it is going to attach to the coronoid process of the mandible. So what this is going to do is it's going to cause you to elevate, and it is going to cause you to retract the mandible. Now, my favorite muscle, just because it sounds like master, is the masseter. There are 2 S's in it, despite what spell check wants it to say. And it is going to attach more to the ramus. And what it's going to do is it's going to cause protraction, which is to stick it forward, and elevation. So you're really going back and forth. The temporalis is causing retraction, whereas the masseter is causing protraction. So here she's chewing. I think she's chewing. We have 2 muscles. We have the temporalis going under the zygomatic arch, attaching to the coronoid process. We have the masseter going this way, attaching to the ramus. So here's the masseter. You can see in this one it's going under, and it's a fan-shaped muscle. So temporalis, coronoid process of the mandible, elevation and retraction of the mandible. Masseter, ramus of the mandible. Now you see why you had to learn all those landmarks. Elevation and protraction. That's too easy. There's more. Well, first we're going to look at the 2 muscles. I like these rotating ones because you can see clearly the temporalis is going underneath the zygomatic arch and where it's attached to, and then the masseter is back there. So we have 2 deep muscles. We have the pterygoids. I didn't really go over the pterygoid processes. We had the medial pterygoid process, which I think is that one, and the lateral pterygoid process. Ptera means wing, by the way. So we have muscles attached to them. This is the external pterygoid right here, because it's on the outside. It is going to insert on the temporomandibular joint and the condyloid process of the mandible. So it's going to attach to the mandible up here, and it is going to be attached to one of the pterygoid processes of the sphenoid bone. Since I didn't make a big stink about them with the sphenoid bone, I'm not making a big stink here. Their action is depression, so it's going to actually be pulling downwards. So let's do downwards there. And protraction. It's going to cause you to stick out your jaw, and it also helps moving side to side. So see how they're in here? So it helps you sort of go inwards as well, side. So it does get some side to side chewing action. The internal pterygoid is attached to the angle. So there's the angle. It is attached to the median pterygoid process, but again, we're not worried about the pterygoid processes. It's going to elevate the mandible, and it is going to move it side to side. So the only one that depresses is the external pterygoid? That doesn't sound right. Because it's not. There's got to be more. Now, finally, I could use my trumpet. Remember, you got sad. First, you got excited because you're going to pucker your lips to kiss. Well, you can still pucker your lips because you went home after eating all that food and you're playing a trumpet. So you need to pucker your lips and you need to squeeze your cheeks. So there is this other muscle here called it's really called the buccinator. I like calling it the buccinator because it sounds like the Terminator. I think they're on part 70 now. So it goes like this. The masseter is more like that. This is more left to right. And what it's going to do is it squeezes your cheeks. It's actually the lateral wall of your cheeks or your oral cavity, and its job is to move food back into your teeth as it's escaping. But you also use it when you're playing a woodwind instrument or a trumpet. So, the buccinator. It inserts on the orbicularis oris, right there, and it is going to compress your cheeks. It helps a baby suckle. Fun fact with a baby, you put a pinky in its mouth, it's going to suckle. It helps with mastication, so it is an eating muscle, by pushing food back into the center. And it lets you play a trumpet. That's the most important thing at 2 a.m. in the morning to bug your parents. So, you need to open your mouth. And these are the suprahyoid muscles. Supra above, hyoid. Remember our hyoid bone? So, we're going to look at the suprahyoid muscles now. So, I picked a weird view intentionally right here. You have these muscles that are attached to the hyoid bone right there, and they actually go up, and they're going to make the inferior floor of your oral cavity. I drew a hyoid bone on this skull. We're going to first have the mylohyoid. This is making up the entire floor of your oral cavity. So this is the mylohyoid. And it is going to come down and attach to your hyoid bone. So I'm going to color this in. So that's the mylohyoid. So we're going to go back to our weird view now. So the digastric is our next muscle. It has two bodies. The first goes from the hyoid bone to the mandible. The second one goes from the hyoid bone to the mastoid process. The mastoid process is going to be a very busy process. We're not going to talk about any of the styloid process. So it has two bodies, and it's basically using the hyoid bone as a pulley. So let's look at those two muscles now. We have, in nice fuchsia, the mylohyoid. And it's making up the entire floor of your oral cavity. We then have, green on green's not going to work, is it? We then have this muscle. It's coming down from the mastoid process, and it attaches to the hyoid bone there. It's then coming from here, attaching. So it's a U-shaped muscle. And it's sort of using the hyoid bone as a pulley to help open your mouth. So it pulls, while the hyoid bone's staying in place, this is going to go down, and so forth. So, the digastric is going to open your mouth. So, here we have the mylohyoid. Its insertion is the hyoid bone, the origin is the mandible, and it depresses the mandible and elevates the hyoid. The digastric, its anterior origins the mandible, posterior origins the mastoid process. Its insertion is the hyoid bone, and it opens your mouth to depress the mandible. So this is one of the weird ones that's actually acting on its origin. Now I should probably point out the stylohyoid right there. Hi, stylohyoid. I like the stylohyoid because it's attached to the styloid process. I think the name gave it away. Its insertion is the hyoid bone. It actually pulls on the hyoid bone to move your tongue, but I will let a speech pathologist talk about that one and not my inexpert talking about tongue movements. As you can see, I could barely talk right now. We're now going to talk about the infrahyoid muscles. These are mainly synergists, or at least I like to call them synergists, that are going to help the suprahyoid muscles by keeping the hyoid bone in place while they're contracting. So my favorite one is the sternohyoid. There's the sternum right there, and it's going up to the hyoid bone. And this muscle is basically going to hold the hyoid bone in place as all the other ones are contracting. So it is a nice synergist. Now, behind it, so this is anterior, by the way, you have the sternothyroid that goes about to there. And then you have connective tissue. You have the thyrohyoid, like there. These are deep muscles. They're on our models for lab, so I thought I'd point it out to you. And then you have another one that actually is going from the lateral shoulder up to the hyoid bone called the omohyoid. And I just like making fun of its name. So you have all these hyoid muscles that are acting on the hyoid that are basically helping you open your mouth. So we have the sternohyoid. That's the superficial. Its origin is the manebrium of the sternum. So we have the sternum right here. There's the sternum. And here's the sternohyoid. You could actually see the sternothyroid and the thyrohyoid behind it. And then here's the one I like making fun of. It's actually coming all the way from your scapula, all the way around to the side. It's called the omohyoid. So they're all synergists. Now, your lateral neck. This muscle is the sternocleidomastoid. I will write it out how my students wrote it out on one lab. As you can see, it was a very long name that they didn't remember how to spell. I think it was like 3 or 4 people did that. So it's the sternocleidomastoid. And what does this name imply? Well, it implies it is attached to the sternum at the manebrium, the clavicle, cleidoid, and the mastoid process. So that is why it is called the sternocleidomastoid. It may or may not have been yelled at me across a crowded movie theater once, and the movie theater might have actually served adult beverages. So, the sternocleidomastoid is going to flex your chin if they both are going together. And it's going to rotate your head the opposite direction. So see how this guy, he's flexing his chin and rotating that way. Its origin is the sternum and the clavicle. And this is one of those bad muscles that actually has an action at its origin. It will help you in hard inspiration processes like running or biking. So it actually does have an action there, which we'll deal with later. But for now, it flexes your chin. And what a surprise, it's attached to the mastoid process. Only 70 more mastoid process muscles to learn. So another muscle that helps you with breathing are the scalenes. There are 3 of them, anterior, median, and posterior. And they start at the transverse processes of the cervical vertebrae. And they attach to ribs 1 and 2. So there's rib 1. I never find rib 2 on this one. There's rib 2. So the scalenes are coming down to attach to them. They elevate the ribs during inspiration cycles. Now, one of my graduate advisor's colleagues about 30 years ago said the intercostal muscles just support the rib cage at rest. It's actually the scalenes that are helping out. And about 5 years ago, 3 articles came out that backed her up with her hypothesis from 20 years ago. I was actually shocked she wasn't an author on one of them. So the scalenes are going to help with inspiration cycles. How, we'll talk about when we get to the breathing cycle. So there's a lot of muscles in the back of your head. We'll talk about the trapezius in the next video, but we have the splenius capitis. Its insertion is the mastoid process. Remember I said the mastoid process is very big? Its origin is actually the spinous processes of your cervical vertebrae, and it's extending your head. Remember the sternocleidomastoid, also attached to the mastoid process. That's going to flex your neck. This one extends it. So we will look at the trapezius and then answer some questions, or ask some questions in our next video. Thank you.